Hi, my name is Latrina Brown, and my topic is herpes simplex virus. So let's get started. So the structure of the virus, herpes simplex, consists of spherical envelope ranging from 120 to 300 nanometers in diameter. It is from the Herpes viridae family, a double-stranded DNA genome with phospholipid-rich envelopes consisting of HSV1 and HSV2. How does HSV interferes with normal pathophysiology? So HSV infects the epithelial cells in the mucosa of the skin and then establishes latency in the neurons, mainly of the peripheral nervous system. HSV1, also known as cold sores or oral herpes, is a severe infection affecting the oral mucosa. HSV1 is mainly transmitted via contact with the virus in sores, saliva, or skin around the mouth. According to the CDC in 2015 and 2016, the prevalence of HSV1 ranked the highest in Mexican Americans at just 71%, age ranging between 14 and 49 years old. HSV2 is an incurable sexually transmitted disease that causes genital herpes. It was ranked the highest in Black Americans at about 40%. Women are twice as likely to be infected with HSV2 than men due to the female anatomy and sexual transmission. HSV in pregnancy. So herpes can be passed to the baby during childbirth, especially if the mother has an active outbreak in later pregnancy. I am an LVN and I come from women's health background at an OB-GYN clinic with nurse practitioners and midwives. So at 36 weeks, we would conduct what we call 36-week labs that consist of a CBC, testing HSV and HIV just to see if there's anything that needs to be addressed as the midwife is preparing the patient for delivery. So totally can be managed throughout pregnancy. You can have a C-section to discuss the risk if you have a current outbreak, but all of that information will be discussed between the provider and the patient, but it definitely can be managed throughout pregnancy. Symptoms. So oral herpes will consist of blisters or cold sore around the mouth, the lips, sometimes the throat. For HSV2, you will present with flu-like symptoms and then painful blisters, sores, or lesions in the genital or anus area. So how to manage your symptoms? So one who has been infected with HSV2 could manage your symptoms until the antivirals kick in. Say you ran out of your prescription and you need something to soothe the pain that you're in. One can take a sitz bath or a warm bath where you will submerge in the water just till you have your genitals submerged in the water to soothe the pain. One can try over-the-counter Tylenol or ibuprofen, and you definitely want to wear loose-fitting clothes and cotton underwear. A big patient education that I used to always say is that you want to make sure that you are cleaning the area thoroughly, gentle soap, warm water, and that you make sure that you are patting the area back dry. We don't want to create any moisture down there. So the 5 stages of cold sore starts off with tingling or burning sensation behind the skin around the mouth. 2 is blistering, fluid-filled blisters around the lips. 3 is weeping, where the blisters will pop and the fluid will come out when you release the pus from a pimple, so to speak. 4 is scabbing, where the scab crusts over and then there's no more fluid, which leads to step 5, which is the healing stage, where the scabs are fully healed and gone. Stages of HSV2. Again, stage 1 will present with with flu-like symptoms consisting of a fever or chills, or maybe even your initial first outbreak. Stage 2 is the latent stage, where the virus is inactive, lying dormant, and may not be replicating at the time. Stage 3 is the prodrome stage, where carriers will experience recurrent outbreaks after their primary outbreak. Stage 4 is the most contagious stage. It's the blistering stage where herpes may begin to form, or you will see red, hard, painful, blistering bumps in the, again, genital area or the anus area. Stage 5 is healing or scabbing, where the blisters or lesions, open sores, will begin to scab over and heal. Prevention. So the number one thing is safe sex practices. You want to make sure that you're using the condom properly, that you are using it for the entire duration of intercourse, and you want to make sure that you have been educated on how to put it on. Want to make sure that the condom is not expired. You want to make sure that there are not holes in the condom. For HSV1, you want to reduce the risk of sharing objects that saliva has touched. For those who have not familiarized themselves with STDs, HSV in particular, you practice abstinence until you have educated yourself on sexual health topics. How is herpes transmitted? Again, herpes is transmitted from a direct contact with an affected person. HSV1, again, it's spread through kissing, sharing lipsticks, sharing drinks. HSV2, again, is sexually transmitted, contacted by sleeping with someone that has been infected, whether you're wearing a condom improperly, not wearing a condom. Those are modes of transmission. The treatment plan. One can be treated. This is a treatable infection virus. It's not curable. So one can treat with antiviral medications where you're using acyclovir, valcyclovir. You can be prescribed by your provider to treat, manage symptoms. One can do chronic suppressive therapy, and that's where you're on long-term use of antiviral medications to help reduce outbreaks. You want to make sure that you are eating a balanced meal, you are managing your stress, just to help reduce the risk of having outbreaks if you are one who have current outbreaks or reoccurring outbreaks. They can also be used as preventative medicines. Know your status. So how do you check for HSV? Again, the new OBs will, upon arrival, we would do a set of new OB labs, and HSV would be included in your blood work. So HSV can check for antibodies to see if you have a current outbreak or if you've been previously exposed to HSV1 or HSV2. One can present with their initial outbreak with sores in the genital area and have the provider swab the open sores or lesions or the pus in the area and send it off to be cultured. In conclusion, to conclude the presentation, the social stigma around herpes simplex is shame, isolation, fear, rejection, and psychological stress of genital outbreaks. With that being said, I think it's a communication thing. You can definitely go on to live a normal life. You just have to be open with communication with your partner. Want to make sure that you and your partner are being tested prior to starting a new sexual history. I know there was a question in the research that asked what demographics is affected more or why. It's definitely the Black American community, due to lack of resources, lack of education, exposure to sexual intercourse at an early age, and not being educated. Sex education helps people people gain the information and skills that they need to make the best decision for themselves about their sexual relationships. And that concludes the presentation. Thank you.